talking about one of the diseases that doctors miss most. Here are some of the symptoms. You're exhausted, you're tired, you can't get out of bed. Or your arms and legs are sore. You could have a constant backache, joint pain, or a throbbing headache, even brain fog. Is this your normal? If so, you may be one of 6 million people who have what is called fibromyalgia. Today, I want to get you to the right diagnosis. Joining me is Dr. Jennifer Cottle, who is at the forefront of treating patients with fibromyalgia. Thank you for joining us.
Thank you.
So could you please help folks understand what fibromyalgia is?
Absolutely. Fibromyalgia is a chronic pain syndrome. It can be very debilitating for patients. Patients often complain of a number of symptoms. Probably the main one is widespread pain. So they have pain all over their bodies, in the muscles, in the connective tissues. And usually this pain lasts for at least 3 months or longer. But in addition to the widespread pain, patients have other symptoms, such as the ones you mentioned: headache, fatigue, insomnia, etc. So it's really the combination of both the pain and these other symptoms that creates this condition. And, it's sort of thought of almost as an invisible condition, because quite honestly, you can look at a patient and really not see it on them. But on the inside, they're really struggling with it.
What kinds of folks are at risk for this?
Well, this condition most commonly affects women. This condition may run in families. We also know that it can coexist with other medical conditions, things like rheumatoid arthritis, lupus, etc. And we also know that sometimes, and this is a theory, that there may be stressors or traumas that actually might even bring on the condition in the first place.
And should folks think of it as a life-threatening disorder?
Actually, Dr. Oz, yes. It's shocking, but yes, this is a life-threatening disorder. Now, fibromyalgia is not a deadly condition. People can live very full lives with this condition, but it is life-threatening. And when I say that, I mean in the sense of the holistic sense. Patients' quality of life is affected. I have patients in my practice that have fibromyalgia, and I've heard them say things like, Dr. Cottle, I feel like I can't get up out of bed in the morning because I have so much pain. I feel like I've been hit by a bus. They can't live their life to the fullest. They can't go to work. They can't see their family and friends. So in this respect, yes, fibromyalgia absolutely threatens the quality of life that patients have.
So it takes folks, I'm going to share this with everybody, an average of 3 doctor visits. 3 doctor visits before getting a proper diagnosis. Now, why is that?
Right. It's pretty alarming, actually, and it's unfortunate. You have to keep in mind that fibromyalgia is a condition that there is no blood test or x-ray for. And this is one of the things that makes it so complex. That and the fact that every patient with fibromyalgia, they have many different symptoms, as you mentioned, but every fibro patient presents very differently. So each fibro patient is usually different from the other.
So when I went through medical school, for most of my practice, we didn't think fibromyalgia even existed. Why did it take so many years, with all these patients giving us complaints that, in retrospect, were this condition, for medicine to accept this was real? You
bring up a really great point. You're absolutely right that in the medical community, even though these symptoms have been going on for years, it really wasn't until about 1990 that the medical community established diagnostic criteria for really diagnosing fibromyalgia. This is a condition that the term hypochondriac, or, the patient's just stressed out, or they're just overwhelmed, those are really inappropriate terms with this condition, because we now know that this is truly a medical condition with important diagnostic criteria and also important treatment options as well.
So essentially what we're saying is you have to play a role in helping medicine understand your problem. So here are some main categories of fibromyalgia symptoms. Pain, you've heard that mentioned a couple times. Fatigue and insomnia, depression and anxiety, and irritable bowel syndrome. Now, there are many other symptoms, and they can vary from patient to patient, as Dr. Cottle mentioned. Now, I want you to meet Judy, who had most of these symptoms, and yet she spent years searching for the right diagnosis.
About 4 years ago, my health took a dramatic turn. It all began like I had the flu. My body hurt, I was nauseous, dizzy, and I could not get out of bed. My doctor told me I had a virus. It was affecting my whole body. I couldn't say, I have a headache, or my legs hurt. It was just everywhere. I went to my ears, nose, and throat doctor, a neurologist. I even was telling my gynecologist. Any and every test they could do, they did. Nobody had any answers. The doctors told me that I was just stressed. At this point, I started to mentally break down. The doctors were making me feel like I was a hypochondriac. I was spending time and money trying to figure out what was wrong with me, and I was left with no answers and frustration. It was the worst year of my life. finally, I went to one more doctor, and he told me that indeed I did have something wrong. It was called fibromyalgia. And just somebody telling me that they could help me, I felt like, oh my God, I could breathe again.
Thanks for sharing your story. So you spent a lot of time, a lot of money, a lot of effort to get the right diagnosis. How did it feel when you were told that it was all in your head?
I felt like I was mad, I was angry, I was upset, but I was scared because I went through test after test after test. You know what I mean? I had brain scans, I had sonograms, I had blood work, I had upper GIs, I had everything done, and they kept saying, sorry, there's nothing wrong with you. And I'm like, a woman who takes care of 4 kids 24/7 and, you know, a family, and I'm laying in bed, and now we're on the 3rd month, I can't get out of bed.
I mean, it angers me, I gotta say, because I hear these stories all the time, and I'm called about fibromyalgia by you, our viewers, all the time. And this is a very common scenario. In fact, I heard you have to bring your family with you to the doctor's office. Why is that?
Because I felt like I needed an advocate to say, she's telling you the truth. You know, she can't get out of bed. She lives a very good life. You know, she's always happy. She's always doing. She's never sitting still. And here she is in bed 24/7.
Did any doctor ever directly say you're a hypochondriac?
Yeah, you know, I kept coming back to my doctors because I knew I was sick and I didn't know what was wrong. And the one doctor said, well, you know, maybe it's in your head, you know, like you're being a hypochondriac.
I mean, I don't know what to say. I'm speechless.
I went home and I cried. I cried and I cried because then I started thinking, am I crazy? You know what I mean? I have a huge social circle. You know, then I'm like, I'm not going to tell anybody I'm sick anymore because if the doctors think I'm a hypochondriac, you know, my family and my friends might start thinking there's something wrong with me. It was very sad.
So how'd you finally get the right diagnosis?
A year and a half later, you know, I'd been sick for the whole year off and on, usually 3 months at a time. And then a year and a half later, it came back real strong, real fast, and I was in the middle of planning something big. And I went back to my regular doctor and I said, I'm sorry, something is wrong with me and I need help now. And he had said to me, okay, I will send you to a rheumatologist. Within 3 months of meeting, within 15 minutes of meeting with my rheumatologist, he said, I know what you have, but I'm going to make you better.
In 15 minutes?
15 minutes. But my regular doctor did say, your back might be up against the wall here. He said, I'm going to be honest with you. Most doctors don't think that fibromyalgia is real. So, you know.
How did it feel, that moment, 15 minutes into your office visit, when you had a diagnosis?
I felt like I'm going to live again. You know what I mean? I'm going to be that person I was a year and a half ago. And, you know, I was trying to hide from my kids. So I'm like, you know, they're going to see their mom back. And, you know, we're going to get through this. And I'm going to sit down on the computer and I'm going to research this. I'm going to find out as much as I can. I was just so happy.
I got to say, I mean, the story that you're sharing with me, I wish it was unique. Dr. Cotto mentioned this is a classic scenario. There are millions of women who are wandering around right now, because most people with fibromyalgia don't know they have it, who are either feeling it's in their head or being told it's in their head. So what do you have to say to all those folks?
You know, I love doctors. I think they're great. But you are the best advocate for yourself. And you have to say to the doctor, no, something is wrong, and you have to keep moving forward till you find the answers because you know yourself better than anybody else. And if I would have just quit, I feel like I'd still be homesick in bed.
You probably wouldn't be still, and there are many people who still are at home watching right now because they can't get out of bed.
Yeah.
Who are walking around with a diagnosis like this or something else. This is not just about fibromyalgia. This is about a lot of problems we just don't have our arms around yet.
Right.
Because we just, you know, have this much of health figured out. We got this much more to figure out.
Right.
Dr. Cole, doctor to doctor.
Yes.
I'll have an open discussion about this. Has it gotten to that point now where we have to ask patients to strong-arm their doctors?
In a sense, yes. It's really important for patients to be advocates. I appreciate really what you're saying. This is actually something I say to my own patients all the time, and even family and friends. The relationship between a patient and a doctor is just that. It's a relationship. So you as a patient, me as a patient, you as a patient, we have to feel comfortable with our physicians. We have to feel like we can talk to our doctor and that we're being heard. Doctors, on the other hand, we have to be good listeners. We have to do proper physical diagnosis and physical exams and also hear the patient's story. So this really is a collaboration. And I absolutely agree that if you're not comfortable with your doctor, I've said this to many people, find someone else. find someone who you really can have a productive collaboration with, because that's especially what's needed with this condition in particular.
Well, I'm proud of you for hunting and pecking and not leaving all that stuff behind, because it would have held you back.
Yes. Thank you.
Thanks for your story. Coming up, could your pain and exhaustion be fibromyalgia and you don't even know it? Find out what to look for when we come back.
I drink a caffeine trigger a fibromyalgia flare-up.
If you've noticed your symptoms get worse after caffeine, you should try to cut back. Start by filling up your mug with half decaf and half regular.
I'm talking about fibromyalgia. Now, millions of you have it, and most don't even know it. Tamara is here because, like so many of you, she wrote to me asking if her symptoms were a sign of fibromyalgia. So can you describe those symptoms, Tamara, for me?
Basically, I've noticed that I've been extremely fatigued. I've been experiencing some back pain recently, as well as at times I feel like a foggy brained, if you will. And when I get out of bed in the morning, at times I'm just like, I feel like almost a sandbag. I'm so exhausted, I'm so tired, I feel horrible.
That sandbag analogy, I hear that sometimes. That's pretty good clue you might have fibromyalgia. How long have you had those symptoms for?
Going on for about a year, but the fatigue has increased over the past couple of months or so.
That's a long time.
Yeah.
That's lovely. Let me explain to you, Tamara, and so many folks, what's really going on, we believe, inside of fibromyalgia. Is that okay?
Yes.
Come on back here.
Okay.
This is what your body looks like. And simplistically, we put little cables here to represent the pain you may feel. But the game in fibromyalgia is not about the muscles or the joints or the hands or the feet. I know that's where you sense the pain.
Right.
It's about the pain dial in our brain. And we have a pain dial up there to help us regulate how we feel pain and how long we feel the pain. That's a good thing, Tamara, because if you bang your arm into something and you have pain, let's turn this down a little bit, you want to sense that pain, right? You want to know you're in pain. It's an early warning sign something's wrong. When you hit your arm, you pull it away, and the pain goes away. That's how it's supposed to function. But in fibromyalgia, here's what we've learned. This pain dial, it gets turned way up. And it's stuck on full. Your entire body begins to ache, even though you only banged your hand. Wow. So the brain is overreacting. It's an early warning system gone awry. That's a fundamental reality of what goes wrong in fibromyalgia. So now we got to figure out what to do about that. Thanks for telling us your story.
Oh, not a problem. Thank you.
And doctors often diagnose these symptoms as MS, as Lyme disease, as back pain, migraines, even menopause, a whole constellation of problems. In reality, for many times, folks, it's really fibromyalgia. So let me bring in world expert Dr. Sean Mackey. He's the Chief of Pain Management at Stanford School of Medicine. Thanks for joining the show.
Thank you.
You got some big news about fibromyalgia, and if you can, what is it that you have discovered that we never knew existed before that could help us make sense of this ailment?
I think we've got some exciting news that for the first time we understand that fibromyalgia is probably not a disease of the muscles, the joints, the ligaments, the tendons, but instead it's fundamentally a condition or a disease of the brain, and specifically the nerves and the neurons that are processing pain within the brain. And what we've learned is that there's a real distinction between someone who's healthy and someone who has fibromyalgia in the way they process normal sensations. Somebody with fibromyalgia and taking normal sensations up from their body, they perceive it as painful. It's as if the volume gain, much like you just very elegantly showed here, the volume gain is turned all the way up to 10 so that they're getting excruciating pain, and pain such that the brain can't ignore it. Now, the other thing that's going on is that normal pain alleviating functions that all of our brains have is all haywire in fibromyalgia. Bottom line is that while fibromyalgia is in the brain, it's not all in your head.
So what do you think is causing fibromyalgia? What's causing the head to respond differently?
Well, that's the million-dollar question. And we know that there are some genetic factors that play a role here, but it really takes an episode that triggers it. It needs something like a minor or significant trauma, an injury. Sometimes it's an infection or the flu. Sometimes it's a little bit of post-traumatic stress. And I've had patients who, after a minor motor vehicle accident, can get a traumatic PTSD and go on to have fibromyalgia. We've learned that all of this sets this cascade up in the brain and also sets our stress and our hormone system out of whack.
So I've often thought diet made a difference. Am I correct in that assumption?
You know, there's been no specific food that's been shown to trigger fibromyalgia. But what we have found is that anecdotally, people who eat a healthy diet, rich in whole grains, fruits, vegetables, an anti-inflammatory diet do seem to do better. And speaking of inflammation, we're now learning that inflammation is probably playing a role here, but not the type of inflammation that you see in arthritis, but more inflammation along the nerves and in the neurons in the brain. And what's exciting about this is that our group and others are now using this information to target that inflammation as new therapies for fibromyalgia.
Thanks for the hard work you do on this. It's groundbreaking work. Now, chronic pain, extreme exhaustion, if these symptoms sound like you, your first line of defense may not be your general internist. Up next, I'll tell you what kind of doctor you should see. Stay with us.
Coming up, how to find the right doctor for fibromyalgia. Plus,
You brought a unique therapy today that I adore.
Trying to help the body heal itself.
and later,
Fight the signs of aging deep under your skin.
is it part of your daily routine?
Cheap, easy to use.
Don't go away.
Heard chamomile tea can alleviate the symptoms of fibromyalgia. Is that true?
There's no direct evidence that chamomile tea works to help fibromyalgia, but it can relax you and help you feel ready for sleep.
I'm not talking about fibromyalgia. I don't want you wasting your time or your money anymore going from doctor to doctor to get the diagnosis that you need. Dr. Dottle, help us with this. What is the kind of doctor folks ought to be looking for advice from in order to make this diagnosis correctly?
Sure. I think it's a great way to start out with your primary care physician. That can be your family doctor, that can be your internist, but you might need a specialist, in which case you might see a rheumatologist. Now, a rheumatologist is a specialist who really focuses on musculoskeletal diseases as well as many others, and they often see lots of fibromyalgia patients, so this is a great place to go. We also think that neurologists might be a great place to go as well, because now we're learning so much more about how fibromyalgia affects the brain.
So rheumatologists and neurologists, the two
Absolutely.
specialists you should all ask for if you're hunting and pecking for the right diagnosis. All right, let's get the treatment.
Sure.
We know there are 3 FDA-approved medications that can help fibromyalgia symptoms, but you brought a unique therapy today that I adore. It's called osteopathic manipulative treatment. And Dr. Martin Levine is joining us. He's an osteopathic physician who uses these practices in his practice. So teach us a little bit, who would this be appropriate for? I'm sorry, yeah, Carol?
Yes.
Thanks for being the guinea pig today, Carol.
So osteopathic manipulative treatment is performed by osteopathic physicians. It's really a way that physicians are able to diagnose and treat musculoskeletal problems with our hands. And really the idea is we're trying to help the body, the patient's body, heal itself. So Dr. Levine here, one of the things that he was doing initially was feeling for muscle spasms in our patient's neck, and he's now stretching out the neck muscles to kind of relieve some of those muscle spasms. Now, it's important to remember that OMT, or osteopathic manipulative therapy, treatment is fantastic for fibro patients. But there are other treatment options: meditation, yoga, cognitive behavioral therapy, etc. But this is one great option.
And ideally, who benefits the most from these treatments?
Most fibro patients will benefit from it. If you're concerned about whether this is a good option for you, make sure you speak with your osteopathic physician about that. But most patients can really tolerate OMT very well and actually be very successful. Dr. Levine now is doing a structural exam on our patient's back, looking for other muscle spasms. And now one of the things he's going to do is he'll lie our patient on her back. And this maneuver really is an attempt to restore the patient's body movements and joints back to their normal range of motion.
Oh, I hear the cracking. I like that. I hope Carol's okay under there. Stop moaning and groaning, Carol. It builds character.
And so this is one of the treatments that he routinely performs, as many osteopathic physicians do. This is great for a lot of pain conditions. OMT can be used for things other than fibromyalgia. So other chronic pain conditions, headache, arthritis, low back pain, you name it. But this is a great option.
How you doing? You okay in there?
I'm okay.
You keep working here. Let Carol enjoy this. It actually doesn't look very helpful. I've actually referred patients for this.
Wonderful.
And I think this type of osteopathic manipulations are worth considering as an alternative, especially for conditions like fibromyalgia.
Absolutely.
So let me speak to everybody about this for a second. If you're experiencing some of the symptoms we have talked about today, we have put a quiz online to help you decide whether you are at risk. You can go to droz.com and take that quiz. Now listen, I know fibromyalgia is a hot button issue for you. So our experts will be answering your fibromyalgia questions. Tweet me at #OzAnswers. You'll be able to help be part of that conversation. Coming up next, the thing you need to take in order to get 5 years off your face and look younger. Find out what it is.
Dr. Oz